All right, let's jump right in. Today we're looking at island resizing. Have you heard of this?
It does sound a little unusual.
It really does. It's a policy idea. And it popped up when COVID-19 was first hitting Brazil.
Hmm.
Yeah, it's a pretty out there concept.
Yeah.
But we've got this research paper that breaks it down.
Okay.
And it focuses specifically on how remote communities in Brazil could have used this island resizing to fight off the virus, those communities that were often hit the hardest.
Yeah, makes sense.
What's really interesting is the timing of this paper.
Okay.
It was written right in those first few months of the pandemic when things felt so chaotic.
Oh, yeah. Total chaos back then. We knew so little about the virus.
Exactly. And data was hard to come by,
Yeah.
especially in those more isolated areas.
Right. So imagine yourself as a policymaker in one of these communities. You see the virus ripping through the cities, and you know it's only a matter of time.
Oh, it's coming for you.
Exactly. What do? And this paper says you need a whole new way of thinking.
A total mind shift.
Yeah, you got it. See, the usual approach to public health emergencies is to wait for the problem to hit. Then you scramble to get it under control.
Be reactive.
Yeah. But island resizing says flip that script, be proactive, anticipate the threat, and take action before the virus takes hold.
Okay, so what does this island resizing actually look like?
Well, the island part is kind of a metaphor. It's all about intentionally disconnecting a community from those bigger urban centers.
Ah, I see it.
So you're essentially setting up a buffer zone to manage the movement of people and goods in and out.
So not completely shutting everything down.
No, island resizing is much more adaptable. You do have physical boundaries, but they can be adjusted, resized as the risk level changes.
I see.
So you start with a wider perimeter, and then maybe you shrink it down to isolate smaller parts of the community if cases start popping up.
So you could have a situation where, let's say, there's a remote village with a nursing home. If a potential case shows up at the nursing home, instead of quarantining the whole village,
Right.
you tighten the boundary around the nursing home.
It's exactly protecting the rest of the community while you zero in on the highest risk spot.
It's kind of like having layers of protection, right? Islands within islands.
That's it. And that adaptability is what makes island resizing so interesting, especially when you consider the limited data and resources they had to work with.
Yeah, that makes sense.
It's like a flexible system.
Yeah.
Communities can adjust their response to fit their unique needs.
Okay, so this idea of proactively taking action, that's a pretty big shift from how public health usually works. Did the authors back this up at all?
Oh, absolutely. They referenced several peer-reviewed studies that really show the problems with those reactive policies. Wait and see.
Especially when resources are already stretched thin.
Right. And one study even found that if you delay even those basic containment measures, even by a little bit, it can really ramp up the spread of a new virus, especially in those densely packed areas.
The authors are saying that acting early and decisively, even if you don't have perfect info, can really help lessen the blow of a pandemic.
Exactly. And they pointed to some historical examples, too, like using those cordon sanitaires during outbreaks of plague and cholera in the past.
Yeah.
So it's not just a new idea. It's got some historical backing, too, showing that strategic isolation, when you do it right, can be really effective in public health.
It's fascinating how they're drawing on all these different sources, both current research and historical precedents, to make their case.
Yeah.
It makes island resizing sound less like a wild idea and more like something rooted in, real evidence and an understanding of how diseases spread.
It is. And this paper, it doesn't just talk about theory. It gets into the nitty-gritty.
Oh, good.
It outlines actual steps communities can take to put island resizing into action.
Okay, I like it.
They even lay out a risk assessment framework to help local leaders decide how strong of a response they need.
So how do they assess the risk in this framework? What are the factors they're looking at?
They look at a bunch of things. Really, it's like proximity to known outbreaks,
Okay.
the number of travelers coming into the community, the healthcare resources available,
Makes sense.
and the overall vulnerability of the people in the community.
So it's not just about how geographically close you are to the virus, but also, are you ready to handle it if it shows up?
Exactly. They categorize communities into 3 risk levels: high, medium, and low.
Okay.
And each level comes with its own set of recommended actions.
So walk me through a high-risk scenario. What would that look like?
In a high-risk situation where, let's say, there's confirmed community transmission nearby, or maybe a large number of residents who are particularly vulnerable, the authors suggest taking some pretty drastic measures.
Oh, wow.
They recommend just going ahead and assuming that everyone in the community could be infected.
Oh, wow.
and enforcing a strict 3-week home quarantine for everyone.
Whoa, that's a serious lockdown.
It is.
Yeah.
Would people be totally cut off from the outside world?
That was my next question.
Well, not completely. The idea is to still allow essential goods and services to come in.
Right, of course.
But the movement of people would be very tightly controlled.
Okay.
They also talk about potentially setting up those smaller boundaries within the community, like we were discussing.
Right, those islands within islands.
Yeah, exactly. Maybe around nursing homes or healthcare facilities.
Yeah.
Just as an extra layer of containment.
So it's about layering those protective measures to really shield the most vulnerable people.
You got it. And they also emphasize the importance of clear communication and community engagement.
Right.
Throughout the whole process. You can't just spring these restrictions on people. You have to explain why they're necessary and how everyone can help.
Yeah, you need people to buy in and understand what's going on.
Absolutely. And that's where strong local leadership is so important.
Right.
They're the ones who can build trust and explain the risks and really get the community working together.
It sounds like island resizing requires walking a fine line between protecting public health and, individual freedom.
Yeah, it's a tricky balance.
How do the authors approach that tension?
Well, they acknowledge that any policy that restricts movement is going to raise ethical concern.
Of course.
And they stress the importance of transparency and proportionality, not going overboard.
So finding that balance where you're maximizing safety without stepping on people's rights more than you absolutely have to.
That's the goal. And they also point out that the longer these restrictions are in place, the greater the potential for negative impacts.
I can see that.
Social and economic impacts. So they really push for ongoing risk assessment and taking a phased approach to lifting those restrictions.
As things improve.
Right. It's really interesting. It makes you think about community and responsibility in a different way.
It does.
It challenges that kind of individualistic mindset that we're so used to, especially in Western societies.
It's about understanding that our actions don't just affect us.
Right.
They affect everyone around us.
And in a pandemic, that sense of collective responsibility becomes absolutely essential.
But let's face it, putting a policy like island resizing into practice, it can't be easy.
It wouldn't be.
There must be some serious challenges.
Oh, absolutely. And the authors are upfront about those potential limitations.
Well, for starters, just enforcing something like this, it seems incredibly difficult.
Yeah.
Especially in remote areas where you might not have a lot of resources or people to make it happen.
That's a big one. That's one of the key concerns they raise. They acknowledge that maintaining these boundaries over time, it's going to take a lot of resources.
Both people and logistics.
And they point out that how well this whole thing works really depends on the community.
Are people going to cooperate?
Yeah. Are they going to comply?
And then there's the data issue. We've talked about how important risk assessment is.
Yeah.
But in those early days of the pandemic, data was hard to come by.
It was.
It wasn't always reliable.
Yeah.
So how do you make the right call when you don't have all the information?
That's a great point. And the authors admit that accurately assessing risk levels without good data, it's a huge challenge. They suggest using a combination of local knowledge, epidemiological models, and whatever data is available.
Even if it's not perfect.
Exactly. It's about making the best decision you can with the information you have at the moment.
And constantly reevaluating as new data comes in.
Exactly.
So island resizing is a really interesting concept.
It is.
But it's not a magic bullet.
No.
There are definite limitations and potential downsides that need to be carefully considered.
Of course. But even with those limitations, the paper argues that island resizing offers a valuable way to think about pandemic preparedness.
Okay.
Especially in those resource-limited settings.
So even if this specific policy doesn't get adopted exactly as it is, the ideas behind it could still be really helpful for shaping public health strategies in the future.
Absolutely. The emphasis on proactive action, risk assessment, community engagement, and local empowerment, those are all valuable lessons that can be applied in all sorts of situations.
This has been a really fascinating deep dive. So far, we've gone from what seemed like a really radical idea to a more nuanced understanding the challenges and possibilities of island resizing. What are some of the key takeaways for our listeners? Those who might not be dealing with a pandemic in a remote village in Brazil.
That's a good question. Well, I think the first takeaway is the importance of challenging conventional wisdom.
Not being afraid to think outside the box.
Yeah, we need to be open to questioning those traditional approaches. and exploring new ideas, especially when things get tough.
It's easy to get stuck in the status quo, right?
It is. And sometimes the best solutions come from really pushing those boundaries.
I agree. And I think this paper also really highlights the importance of community resilience.
Yeah.
And that collective action, that we're all in this together idea.
Absolutely. We live in a globalized world, and what happens in one community can affect us all.
It's about recognizing that our choices don't happen in a vacuum.
Right. They have ripple effects.
And that sense of shared responsibility is so crucial, especially now.
It is. And lastly, I think this paper reminds us that even when we're facing huge uncertainty and limited resources, there's still room for creativity.
And to be proactive.
Yeah, to think outside the box and find solutions. Yeah, it's like they say, necessity is the mother of invention. When we're in a crisis, we often come up with the most creative solutions.
It's true. And what strikes me about island resizing is that it's not just about containing a virus.
Right.
It's about building a stronger community, a more resilient community.
Yeah, I agree. By taking these measures, you're not only protecting people from the virus itself, but you're also strengthening those bonds within the community. You're fostering this sense of responsibility for one another.
Yeah.
And you could even be creating a more equitable and sustainable way of life.
That's a really good point. And the authors of the paper, they make it clear. They highlight the social and economic benefits of island resizing, not just the public health benefits.
Right. Can you say more about that?
Sure. They argue that when you put the health and well-being of the most vulnerable first, you're actually protecting the whole local economy.
Makes sense.
If people are healthy and can work, the community as a whole is more likely to prosper.
It's all connected, isn't it?
Yeah. Public health and the economy, they go hand in hand.
They really do. You can't have one without the other.
And this paper shows that even in places with limited resources, you can still put policies in place that help both people's health and the economy.
It's about finding those solutions that benefit everyone, both individually and as a group.
So, island resizing, while it was designed as a response to a pandemic, it could have much broader implications for how we think about community development and resilience.
Absolutely. It's a great example of how a crisis can lead to real innovation and positive change.
It makes you think, doesn't it?
It does.
Could we use these island strategies to tackle other public health issues, like chronic diseases or substance abuse? Or could we adapt these ideas to make communities more resilient in the face of natural disasters?
Or even climate change.
Right, exactly.
Yeah.
Those are some big questions.
They are.
And it speaks to the larger point of this paper, which is that we need to be constantly adapting
and innovating
and rethinking how we approach these big collective challenges.
Yeah, and we need to do it together. One of the most interesting things about island resizing is that emphasis on community engagement and giving power to the local level.
So it's not just about those top-down decisions.
No.
It's about empowering communities to take charge of their own health and well-being.
Exactly. And that's a powerful message. It goes way beyond this one paper.
It really does.
It's a call to action for all of us, to think creatively, to work together, and to build stronger communities that can handle whatever comes our way.
Well said.
Yeah.
And for our listeners who are now thinking about island resizing and what it all means, we encourage you to keep exploring these ideas.
Absolutely.
Dive into the research. Talk to your community.
Yeah.
And maybe even think about how you could apply these principles to your own life and the challenges you face.
Because at the end of the day, the most important thing we can take away from this deep dive isn't the specific policy itself. It's that spirit of innovation, that resilience, and that commitment to working together.
It's about coming together as a community to face whatever challenges come our way.
Exactly. And as we move forward in this increasingly complex and interconnected world,
those qualities, that innovation, that resilience, that's what's going to make all the difference.
Couldn't agree more.
Thanks for joining us on this deep dive. We hope you found it insightful. And maybe even a little inspiring.
Definitely.
We hope you feel ready to tackle whatever challenges and opportunities come next.
That's what it's all about.
Thanks for listening.